Hello everyone, welcome to Talking Health with DrLaz, your favorite health program on television, reaching you from Nigeria's capital city, Abuja. My name is Dr. Laz Eze. Yes, as 2023 elections come closer, a lot of activities are taking place, and the health sector is not left out because a number of advocates, the National Advocates for Health, Universal Health Coverage Forum 2023, also known as UHC 2023, UHC Forum 2023, and many persons are having conversations to ensure that health becomes a topical issue in the next election cycle, because without health, we have nothing. So we'll be talking more about that, but it's just important that we don't leave health out in the conversation as related to elections. But that's not our topic for today. Before we also get to the topic, recently there are media reports from the Obafemi Awolowo University Teaching Hospital that the Association of Resident Doctors embarked on a 2-day warning strike. And their reason was due to an allegation that one of their colleagues was assaulted by a nurse on duty. And of course, the Nurses National Association of Nigerian Nurses and Midwives, OAU Teaching Hospital chapter, even had to engage a lawyer to say that they are trying to enforce the rights of their colleague, and also went on a 3-day warning strike after the resident doctors did that. Imagine two issues involving two healthcare professionals, a doctor and a nurse, and the patients are being made to suffer for it. Absolutely unnecessary. I'll speak more about it towards the end of the show. Yes, today we'll be discussing a very important topic that both men and women find, will be very much interested in, and that's erectile dysfunction. Yes, erectile dysfunction is a matter that matters to everyone, male, female, families, husband, wives, everyone for that matter. And a specialist or an expert in this area will be joining me. We'll be using the video wall. I will be projecting some images, involving the male reproductive organ, the penis. We are now seeing this. We're using it just for educational purposes to show the anatomy so that people could understand better what we'll be talking about, But no gory image will be used. Definitely, I hope after the program, you'll be very much better informed. And for those men who use some substances that even cause more problem for them, who desist from using that. Do stay with us. I'll introduce my guests, but after this break. Welcome back to Talking Health with Dr. Laz, your favorite health program on television. Yes, we'll be discussing erectile dysfunction. Of course, is a health condition that affects men directly and women indirectly. And joining me to discuss this is a consultant urologist at Zenith Medical and Kidney Center in Abuja, Nigeria's capital. He is Dr. Uzodimma Onwuasoanya. You're welcome to the program.
Thanks for having me.
Yes, a urologist is a specialist who deals with any health condition or disease involving the male reproductive system, from the bladder to the kidney to the penis, ureter, uretras, and all of that. And we are very happy to have him on the program today. So let's get to the slides. So why that comes up, what is erectile dysfunction?
Okay, to define it in a very simple way, it can be defined as a persistent inability to sustain or achieve erection enough for a long duration to achieve satisfactory sexual intercourse. That's just a simple definition.
Right.
Yeah.
So let's get to know the normal, how erection is achieved.
Yeah.
Yes, the conversation is going to take this outline. We talk about the anatomy of the penis. Of course, we are going to project the image of the penis with the internal components. The mechanism of erection, Dr. Onwuasoanya is going to talk about that. Classification of erectile dysfunctions, the causes, diagnosis, and of course, the treatment. So let's roll. The anatomy of the penis. I think the next image is going to show us that.
Yeah, we're going to discuss the anatomy of the penis based on these parts, that the way it was broken from the image. So we'll start from the skin of the penis. You can see the superficial dartos fascia, and then the deep fascia.
So the skin is the outer
the outer
covering.
Cover, yeah, outer cover, yes. Then from there you now have the tunica albuginea that is covering the main erectile tissue. That's the corpus cavernosum. So the tunica albuginea covers it. These two layers are the main, the corpus cavernosum. These are the main erectile tissues. Then for that, there are two, but they surround the another tissue, which we call corpus spongiosum. That's it. That surrounds the urethra.
Urethra is the pipe that through urine, urine comes out through the urethra.
Urine passes from the urethra out, for us to say. Okay, so that's it. So we'll talk about the arterial supply in the next slide.
Right. So I can see the internal pudendal artery, or this. Our viewers who hear medical words tired today. Okay, so talk about this arterial supply to the penis.
Okay, the main supply, the arterial supply to the penis comes from the internal iliac. It gives the internal pudendal, as you can see over there. That now gives other branches, but the main arterial supply to the penis is the cavernosal artery, as you can see. So that's the main artery that's involved in the erection that we'll be talking about. There are other branches, as you can see from the image.
Yes, covering other components. Okay, so let's move. What was? Can we go back? Yes, what's there?
Okay, these are around the pubic area. You have the ischiocavernosum muscle and other things that also all of them play a part in the erection. But that's the pubic bone area.
All right. Yeah. So let's move. Those bones are just those other organs around the penis. This looks like the venous supply. Yeah, that's the venous supply. Yeah. So that's the venous supply. It still follows the same. It drains back into the internal iliac vein. There are some tributaries from the vein that goes and then comes back. The main thing we're concerned also is these ones, the subtunical venous plexus. That's also the main thing we are talking about. That's the main venous drainage that informs the erection. There are other tributaries that joins it, but this is the main one, the subtunical venous plexus complex. All right. So our viewers might be wondering, the arteries, the veins. Simply, the arteries bring blood to the penis, and the veins drain it away from the penis. So when the heart pumps blood, the arteries take it to the various parts of the body. So, and the oxygen, after the usage, the deoxygenated blood goes through the vein back to the heart. Just the simple circulation. So every part of the body has arteries and veins, and they have different names. So don't be distracted by these are anatomical names. I will get to the main business very shortly. So let's move to the next slide. Okay, so the blood vessels play a key role in erection. So can you take us through the various stages? Okay,
this is normal flaccid penis without erection.
Okay, flaccid is the one that is at rest.
No, normal pressure, normal is not erect. So it's sexual stimulation that stimulates the process of erection. So when there's a sexual stimulation, what happens is that there are neurotransmitters that will be released from the cavernosal nerves, the nerve that supply the penis. So this neurotransmitter is mainly nitric oxide. When it's released, it leads to production of what we call cyclic GMP, cyclic guanidinoate monophosphate, which now is the main agent that causes relaxation of the blood supply to the penis. That relaxation causes increased blood flow to the penis.
Through the arteries.
Through the arteries, yes. Through the arteries into the cavernosal spaces. So that increased blood flow now starts the whole process. This initiation. Then as the blood flow increases here, you can see as it increases and it flows in, the cavernosal spaces dilate. Yes, you can see expanding. So as it expands, it constricts the vein. This is the venous. As it enters and dilates the spaces, the venous outflow of the blood gets constricted, preventing blood outflow from the penis. Just to hold the blood inside. Is that blood that is inside?
Plenty blood inside
it makes it to erect.
Gets bigger and all of that.
Yes.
But you said if there is a stimulation, what about people who have erection while sleeping?
Okay,
like early morning or even small children, sometimes they have erection. Must there be that kind of stimulation before it happens?
No, that one we call it nocturnal penile tumescence. That one is due to surge of the hormone called testosterone. That happens early in the morning. So when there's a surge of that hormone, early in the morning, most times it stimulates erection. We should talk about the role of testosterone.
And it's normal.
It's normal. That one is normal. In fact, that's one of the things that shows, that's one of the first things we ask patients. If you come and complain of erectile dysfunction, we ask you, do you have erection early in the morning? That tells us whether it's a hormonal,
level
hormonal issue or, yes, that's the first thing we ask.
I brought that point because people really need to understand this. So let's move to the next slide. Yes, so this the full erection. I can see here has got bigger and the veins.
Yes. That's where we'll talk about.
Is this where the constriction?
The constriction is that we saw the subtunical venous complex that I showed earlier in the anatomy. So that's the main constriction that happens. There's subtunical venous complex and there's also a mystery venous complex between the two layers of that tunica albuginea. So these are the main veins that are constricted. To stop blood from flowing into the penis. So that's what's depicted by that diagram. So that's what happens.
So it moves to the rigid erection.
The rigid erection occurs when there is contraction of the ischiocavernosus muscle. That's the main muscle that we're showing that big bone area. One of the muscles around that area. When it contracts, that's what gives the rigid erection. Because at that point, there's a maximal increase in the pressure, cavernosal pressure. So that's what gives the rigid erection.
And that's when orgasm gets achieved, right?
No, it depends on whether the person has started the sexual process or not. So when the rigid erection is at the point when the person is ready for full sexual activity. So it's along the way that now, ejaculation and yes.
So after that, it returns.
So after during the sexual, when the time for the orgasm, when it's time for orgasm, after a person ejaculates, what happens is that there is release of sympathetic release during that process of ejaculation. So that helps to cause contraction of the arteries, which we know it was dilated before. And also there's a release of phosphodiesterase. That causes breakdown on the cyclic GMP we talked about earlier. So this breakdown, all these things, just cause contraction of the processes. Causes contraction of the arteries and opening up of the venous sinuses. To cause relaxation of the tumescence.
So we get to the causes of. Let's get to the next slide. We may not dwell much on this. This is just a closer image that shows
what we just discussed about.
What we just discussed. We
can see the artery at the normal state. This is the flaccid state. Let me point. This is the artery at the flat. Not dilated. You see the spaces. You see the subtunical and the mystery veins. So during erection, as you can see, the artery
has got bigger.
Yes, you can see the
veins are smaller.
You can see the space is also wider. So this is what happens. Just to summarize what we just discussed about. So the main veins are the subtunical venous complex, as you can see, compressed subtunical venous plexus. And then the mystery veins, as you can see.
So we'll move to talk about the causes. But what I want you to understand, we've used a lot of anatomical terms. Medical students and medical professionals also watch these programs, so we need to carry them along. And some of them, this might be a refresher for them, actually. So, but what you need to understand is that the blood vessels in the penis play a key role in erection. And he also mentioned about hormones. Hormones are substances in the body that control a lot of things. So with this understanding, you get to know if anything happens to this structure, and also the blood flow within the blood vessels, that there could be problem with erection. So we'll get back after this break, and we're going to be talking about specific causes and what to do for persons who identify that they have erectile dysfunction. We'll be right back. See you. Welcome back to Talking Health with Dr. Laz, your favorite health program on television. And with a consultant urologist, we are discussing erectile dysfunction. That's inability of the penis on the male private organ to do its job very well. Dr. Uzodimma Onwuasoanya, yes, we've talked about the anatomy and the physiology. So what are the causes, the common causes in our environment of erectile dysfunction?
Okay, most times, as in more than 60% of the time, is actually there's no cause for it. It's idiopathic.
More than 60%, the cause is not known.
Yes, but the cause is broken into either organic or psychogenic.
Okay.
Yeah.
So organic, psychogenic. Organic has to do with the penis, anything that happens to the anatomy or the functions of the penis. Psychogenic has to do
psychology,
with psychology, the mental state of the person. So what are those specific causes? These ones are like, okay, we're in a medical classroom. So let's speak in the language of the streets. So what are those things that could fall under the organic, using the language that's non-medical people will understand?
Most times, erectile dysfunction most times starts from the age of 40, commonly.
Okay.
The reason is because there are other diseases that start, other comorbid conditions that develop from that age upwards. So these comorbid conditions are the main things that predispose to erectile dysfunction.
What are those?
Hypertension, diabetes.
Diabetes.
Yeah, some people also that have hyperlipidemia.
High fat level in the system.
Yes. Okay. Some hypogonadism too. Low testosterone. Yes, hypogonadism from low testosterone.
Okay. Also, so if the testosterone hormone is inadequate in the system.
Also the elevated prolactin, hyperprolactinemia.
Prolactin is the hormone that controls breasts.
Controls breast,
lactation. Breast production and lactation. So if it's high in a man, because it should actually be higher in women.
Yes, it should be higher in women.
So if it's above the level it should be in a man, it can lead to erectile dysfunction.
Yeah, it can lead to erectile dysfunction. So these things, these are the common ones that affect either the blood vessels, the nerves.
What about sickle cell disease? Does it have any effect?
It's still through the vasculogenic. Yes, it does.
Okay.
It's still the effect it has on the blood vessel. The artery mainly. The most of these ones that affect the blood vessels of the penis, it affects it mainly by narrowing the blood vessels.
Okay. Is there any kind of infection that could predispose to that?
Well, for now, there is no documented infection that can lead to erectile dysfunction.
Not even gonorrhea, syphilis, and all these sexually transmitted infections.
Those ones they mainly cause infertility. Infertility affecting, but when it comes to erection, they don't really have much.
Effect.
Yes.
Okay.
The sickle cell, those ones that have effect on the blood vessel, on the nerves.
Okay.
Those have effect on nerves and the blood vessel. That are the main ones. The diabetes, the hypertension, the sickle cell disease, and other hormonal issues, and also accident as well.
Accidents can injure some of these.
Spinal cord injuries, pelvic trauma, these are the...
Fall stride injury.
All those ones, yes.
Okay.
Even some surgeries that are not well done by experts can also...
Can also cause off some neurons.
And also treatment of some disease like priapism. The treatment...
Priapism is when the penis stands and refuses to relax. Try to put it in a very simple terms. When the penis is erect and refuses to relax for one reason or the other.
Aphrodisiacs.
Abuse. In fact, use of aphrodisiacs. That's all these substances that people take to enhance sexual performance. They call it manpower and all kinds of names. So can it predispose to this?
It can predispose. It can predispose to priapism, that persistent erection.
Okay.
And then when it lasts for long, normally the treatment of priapism should be done when it caused by all these things. It should be treated within 24 hours.
Okay.
If it's not treated within 24 hours, it can lead to erectile dysfunction. And if it's treated, the treatment can also predispose to that.
Wow. What about masturbation? Some persons say, okay, for people who masturbate a lot, they could have problem. Does it have any effect on erectile dysfunction?
Yeah, based on trauma, some people, the way they do it, can injure the penis because the forceful way of doing it can lead to penile trauma, penile injury.
Okay.
So that injury can now lead to erectile.
So could it cause penile fracture?
Well, no, penile fracture most times doesn't come from masturbation.
Okay.
It's forceful and I'll call it athletic sex.
Okay.
Athletic sex.
Too much energy.
Forceful sex that when you hit the female pubic bone, most times that what leads to forceful and rough sex is what leads to most time penile fracture.
Okay.
Yes.
So we projected this. Perhaps people with medical background will understand the language better. But essentially, He has said a lot of things. Diabetes, hypertension, persons with sickle cell disease, injuries. These are things that may cause erectile dysfunction. But he said that over 60%, that means out of every 10 cases, you might find 6 that the causes are not known. But if you find it, you could attempt to treat it. But he said infections are not known, at least medically speaking, to have significant effect on erection. So knowing these causes, how do we, of course, the diagnosis is straightforward. Yes. So talk a bit about the diagnosis and, of course, what people who have this problem need to do.
Okay, diagnosis has to do, first of all, with a detailed history, medical and psychological history, very important, psychosocial history and medical history. We take a detailed history.
I think the next slide has information on that.
Yes. Yeah. We take a detailed history of start with the patients when the issue started, how it progressed. Is it an issue with just erection? What of ejaculation? We take a detailed history. Ask about the partner. Diseases, all those comorbid conditions. We ask good questions about them. Okay. So we can arrive at if we can lay our hands on the cause or not.
Okay.
Then from there, we'll now proceed to do a focused physical examination.
Okay.
You examine the penis, look at the penis, because there's a condition called Peyronie's disease, which disfigures the penis. That can also lead to
disfiguring the anatomy?
Yeah, disfiguring the anatomy of the penis, yes. So that you can see that from physical examination.
Okay.
So that can be can tell you about the cause. Also look at the penis as well. Check the testis. If it's reduced in size, you are taking more of hypogonadism.
Okay.
That's low testosterone, which can also predispose to it.
Okay.
We examine the prostate as well for these patients, because prostate disease and treatment of prostate disease can predispose to erectile dysfunction. So these are the main focus examination. Then we'll now do some basic investigations, basic tests, just to look for those comorbid conditions. You check the patient's blood glucose level.
Okay.
You check the basic hormones. You check the lipid level as well.
Okay.
Yeah, so just to have...
So all these things, you take the blood sample.
Yeah.
So people say this erectile dysfunction, does it lead to either quick ejaculation or delayed ejaculation? Does it have any effect on the performance, sexual performance?
The quick ejaculation is another dysfunction on its own.
Is a dysfunction on its own,
not erection.
Has to do with erection. Okay.
Yes. It's another dysfunction on its own. It's different from erection, erectile issue. Yeah.
Okay, that's fine. So there is this stuff people say JD. Do you hear it from your patients?
JD, that's mainly diarrhea. I hear mainly from patients that are small, having diarrhea. They call it JD most times.
It's used more often in the southwest parts of Nigeria. So persons use it to refer to health conditions they think has to do with sugar consumption. Yes. If someone has bile, they say it's JD. He has erectile dysfunction, they say it's JD. He has some abdominal, this thing, So, but what we are emphasizing is from the anatomy and the physiology, these are potential things, and investigations are done taking blood. So on treatment, what are the options? Of course, without mentioning specific name of drugs, what are the options?
Well, the treatment depends on your finding from evaluation.
Okay.
Whether it's a psychological issue, if it's a psychological thing, counseling alone, we provide a solution to it. Most times you have to see the patient with the partner and then try to offer counseling. Counseling will solve that problem most times. Although it tends to recur more when it's a psychological issue, it tends to recur, but at least serial counseling helps. But if it's not psychological, then normally we'll offer medical treatment first.
Okay.
We'll start medical treatment. We use phosphodiuretic inhibitors commonly.
Okay.
Yeah, we'll start from there and then see how the person responds to it.
Okay.
If you respond well, we'll continue for a while. But if you are not responding well, we can increase the dose, or titrate, adjust the dose to see whether you respond.
Is there a treatment that goes for a very long time?
Yes, it goes for a very long time, yes, most times. But most of my patients that responded to medical treatment, I don't have to continue them for more than 6 months.
Is there a place for herbal solution to this? I know you are not a herbalist, but a lot of people believe so much, so some persons even feel the abuse of some herbal substances maybe even be the cause of erectile dysfunction. Can you speak to that?
Yes, there are some people who actually use herbal drugs most time. In fact, I've treated a patient that actually took a herbal drug for erection and then developed priapism, as we talked about.
Okay.
Came to me 5 days after.
Wow, that's a very long time.
Very long time. Yes. So I had to, by the time I finished treating him, of course, I cancelled him faster that the penis might not be able to erect again afterwards. So that's the main issue we have with this, because we don't know the content of these herbal drugs. They can lead to prolonged persistent erection. They can also affect the kidneys as well, because you don't know what these things contain. Most of them are not well studied. There are documented herbal drugs
that are helpful,
yeah,
right?
helpful, but most of the ones we use on the streets are not.
And the space is poorly regulated, so anybody could just take anything to the street.
So actually, we don't advise patients to take herbal drugs. We advise, if you have any issue with erection, just try to see a specialist. See a specialist, then we'll try to find the cause.
But there are some herbal practitioners who also claim to be specialists in managing this condition. And herbal medicine is actually there's a department in the Federal Ministry of Health on trado medicine and all of this. So I think for those who are certified and well trained, they will do the right thing, but not patronizing all these roadside people who bring substances and on the streets of Abuja, just near all these banks and
everywhere.
They'll just approach you and say, "Power."
Just be doing hand like this for you. Sometimes what they do, that's what they do. So we don't advocate those ones, but those I will talk about, those as you say, those are licensed and certified. Then there are documented herbal drugs for it actually. Although we are not herbal practitioners, but there are if you go through those ones,
the ones people who are experts in that, All right. Thank you very much, Dr. Uzodimma Onwuasoanya, consultant urologist, Zenith Medical and Kidney Center, Abuja. Thanks for being on this program.
Thank you.
All right. We really thank you for watching the show today. Of particular interest to us is that the rights of patients must be respected, and we must prioritize our patients as healthcare professionals. I found that very disappointing that healthcare workers would deny patients care just because two professionals had issues. And for it to escalate to this level also speaks a lot about the lack of, perhaps, competence on the hospital management, towards managing issues like this. While you may not completely prevent misunderstandings at the workplace, our patients should never be made to suffer for something they absolutely know nothing about. I hope the Federal Ministry of Health and the management of Obafemi Awolowo University Teaching Hospital would take certain actions. Left to me, people should lose part of their pay, for missing work over a reason I consider flimsy. Nigerians are suffering a lot, and people who are being taken care of in health facilities should not be denied care just because two professionals had misunderstanding. My name is Dr. Laz Eze. I'll see you same station, same time next week. Bye for now.